All so much for coming today. My name's Wabz, everyone calls me Wabz. I'm here with my colleague Paul, who you can see over there. I'm a physiotherapist and Paul is a pharmacy technician. We're from the proactive team. Our specific team is ICAT. We work with people who are slightly older, and we see people in their homes, and we do what's called a holistic assessment. So what we're going to do today is we're going to talk to you a little bit about staying healthy, staying strong, the importance of staying strong, and we're also going to talk a little bit about bone health as well, okay? So first of all, just to give you an intro, a breakdown to what we'll be talking about, I'll explain a little bit more about frailty. So when I say we work with older people, we're talking about frail patients specifically. We'll be talking about resistance training and its benefits, talking about muscle and joint strength, strong bones, which is what it's all about. We'll also be looking at medications, which are very important, and a lot of you here today will be on various medications. And we talk about balance and falls as well, which is what we're trying to improve and prevent. I'll let you work out which is which. And then we'll talk about fragility fractures. So all these kind of tie in together, and hopefully throughout the presentation you'll see how they're all interlinked and what you can do to try and prevent having any falls and fractures as a result of falls. And then we'll talk a bit about prevention, okay? So to start off, so frailty, there's sort of descriptions here about what frailty is. It's the ability to bounce back. It can be referred to as having 2 or more medical conditions and a disability in that you may have a difficulty performing what you used to do before. But to us, generally, frailty means that if something happened to you that, say, a few years ago or your younger self would have recovered quite quickly from, if it happens now, you wouldn't recover as well. Okay, so for a lot of us, we've had falls as young adults. If you have a fall now, there's complications. So that may be an indication of frailty. Or if you have an illness and it takes a longer time to recover, these are all indications that perhaps we're becoming more frail, okay? It's important to understand that frailty is not an inevitable part of aging, okay? So not all older people are frail. The prevalence of frailty increases as we get older, but the two aren't directly connected all the time, okay? And frailty and disability are different as well. Okay, so resistance training. Some of you may be aware about training and exercise. What I want to talk to you today about specifically is resistance training, okay? Resistance training is when you use your muscles to exert a force against the resistance. Now that force can be anything. So the force can be your body weight. So with our legs, when we're walking, going up and down stairs, or you can use household objects, bottles of water, cans, whatever's safe to do. You just want to make your muscles work a little bit more than they normally would to exert a force, okay? And then our muscles will respond and our bones will adapt as a result of that. So there's a list of some of the things that we can use to do resistance training. As I said, there's things in the home, but there's also things like, weighted vests people use. Some people like going to the gym, but the gym isn't for everyone. But if you like going to the gym, you can do resistance exercises there as well, okay? So next one. So now the benefits. What we're interested in is the benefits of resistance training. The benefits are huge. So this list is actually an exhaustive list. There's actually a bit more than this, okay? So this is just touching on some of the key areas of our health that resistance training can help us with. So with our heart, okay? So our quadricep muscles, which are our leg muscles, the big muscles that carry your weight, there's been research to show that the strength and size of these muscles relates to your heart function, so the strength of your heart, and your cardiovascular longevity. So your overall health, your heart and lungs is directly related to your legs. Which kind of makes sense if you think about it, because when people are fitter, they often walk more, or they might jog and such, and the muscles are used for walking and jogging and going up and down stairs. The more you use them, the fitter you get. So the two are very closely related, okay? You can also reduce the risk of diabetes because your muscle mass influences your metabolism. I'm not sure how many of you know what metabolism is, but basically it's a general term used for sort of the biological processes and chemical processes in your body. You hear people say, I've got a fast metabolism, I've got a slow metabolism. When people talk about they burn calories really quickly, like kids do, that's a fast metabolism. a slower metabolism, generally you burn calories slower, you might be more inclined to gain weight. Your muscle mass, your lean muscle tissue, in relation to the rest of your body, generally the more muscle you have, the more muscle tissue. This doesn't mean big bulky muscle, it just means muscles that are working. The more you have, the faster your metabolism is, so the more energy you can burn. But what's really important in terms of diabetes and sugar, so diabetes is related to your body's ability to manage sugar, to get sugar out of your blood. Sugar is converted to glucose in our body. Anybody here who has diabetes will talk about you'll have tests to check your glucose levels and such. But this sugar, when it's converted, is stored in our body. It's stored in our liver, it's stored in our muscles. In our muscles, it's turned into something called glycogen. So the more muscles tissue you have, the more lean muscle tissue you have, the greater your body's ability to manage and store glucose. So this affects diabetes. So some people, especially if you're pre-diabetic, by increasing your muscle mass through exercise, you can actually slow down or reverse that condition, along with a healthy diet as well. Okay, so it's really important to understand that having muscle strength actually can help with the management of diabetes. Stronger bones. The reason we talk about bones sort of pop up quite a bit in this is because that's often the outcome or result of perhaps having weaker muscles and poor balance, is that people may experience falls and then you may experience a fracture, okay? We don't want people to experience falls, but should that happen, ideally you wouldn't want to break something if you did fall, okay? The way to prevent that, ideally first, you don't want to fall obviously, but if you do fall, you want your bones to be strong enough that you won't fracture something, okay? Exercise, weight bearing, resistance exercise builds bone, okay? It makes your bones stronger. It retains the strength in your bones so that should you fall, you're less likely to fracture your bones. And we'll talk about things like osteoporosis. Paul will talk about it later on. Also improved cognitive function, okay? So cognitive function is your brain processing your thoughts, okay? Research has shown that resistance training specifically can help with your memory, your coordination and your balance. Coordination and balance, most people understand will make sense because you're using your muscles to coordinate and balance when you're walking and moving. But most people would be surprised to realize that this type of exercise can actually help your memory, and it can delay the onset of memory-related conditions such as dementia, okay? The reason for this is that when we exercise, one, it increases blood flow. This blood flows around the body to our brain, but also hormones are released in our body as we exercise. And some of these hormones act in our brain in a specific area called the hippocampus, which is responsible for memory. So through exercise, we stimulate this part of the brain that's responsible for memory, and it helps us with retaining memory and with learning as well, okay? Also lowers blood pressure because, again, with exercise, your heart works a little bit harder, the blood vessels expand and contract as the heart pumps, the blood vessels become a bit stronger, more efficient, more robust, okay? And the most important thing, a longer life. I should have actually put healthier, a longer, healthier life. Muscles and joint strength. So as we should know, or as most of you know, your muscles move, they move your body. But muscles attach to bones and they work across a joint. So these are your skeletal muscles. We have muscles inside our body, our heart is a muscle. So lots of internal muscles, but here I'm talking about your skeletal muscles, so the muscles that are sort of more superficial that you can see on the outside. So they all work to move a joint, okay? So when muscles pull, all muscles do is pull. Every muscle just contracts, all it can do is pull. So even when I'm straightening my arm, the muscles at the back are pulling to straighten my elbow, okay? And the good thing with muscles, because they work across joints, strengthening your muscles can help to support the joint as well, which means that the people who have joints pain, especially in the weight-bearing joints, especially your knees, strengthening the muscles around that area can help that joint. It doesn't change any damage that you may have, but in terms of the pain you feel, it can reduce the pain and it can also increase your ability, okay? I used to work as, before I was a physio, I used to work as a personal trainer. I remember I worked with, and I think she was head of year at a school, and one of the things she came to me for training for was to be able to go up and down the stairs without it hurting. Her knees always hurt when she went up and down the stairs. And with regular exercise and just strengthening the muscles around her knees, she was able to not just go up and down the stairs, but she was able to jog up and down the stairs at her school, which was brilliant. So a lot of us who may be on medications or finding ways to try and manage joint pain, sometimes through exercise, we can actually strengthen the joints and reduce the pain. Okay, so it's a really, really beneficial thing to do. So I'm about to talk about balance and falls. But just before that, I'd just like to go back a little bit and link in to explain a bit more about bone strength. So Paul's been talking about bone health and talks about osteoporosis. So a lot of people will be aware of osteoporosis, which is a thinning of bones. But just as a bit of background, just to explain, so what happens with our bodies as we're growing during our puberty, teenage years, and in our early 20s, our bones are getting stronger. Okay, and then they hit a peak in our early 20s, which from an evolutionary point of view would have been when early humans would have usually had their children and raised their children. So your bones have done their biological function as far as they're concerned. And after that time, our body naturally starts to break them down. Okay, so two things to know is that the amount of density that your bones have at the peak depends on factors such as your genetics and active lifestyle and your lifestyle. So we should encourage those who have children, grandchildren, grandnieces, whatever, should encourage them to be active, because before people used to skip and run and jump and play, that increases your bone density. So when they get to their early 20s, they'll have a higher bone density. The rate at which the bone density decreases depends again on your lifestyle. So the more active you are, at whatever age, the more active you are with the resistance, the slower the bones will decrease in density, and sometimes the bone density can actually increase a little bit, but especially with some of the medications that Paul is talking about. But it's really important to know that along with balancing and trying to prevent falls, as I said earlier, the whole reason we want to prevent falls is that we don't want to fracture something. Trying to get our bones stronger is really important. So it's really important throughout all of this to remember we want to keep our bones as strong as possible. So with that in mind, I'm now going to talk a little bit about balance and the various components of balance. So balance is the ability to maintain your center of mass over your base of support. Okay? So just to give examples of this, so there's various things that come into play when we look at balance. I'm a physiotherapist, so when I look at balance and things like base of support, so your base of support and the center of mass for me is sort of roughly around my belly button. My base of support is my legs, okay? So my belly button is roughly in the middle of my legs, so I'm balanced. Now, if you imagine my posture changes, as some people get older, we might become a bit stooped. So if I'm now stooped, and I haven't got a stick or something to support myself when I'm walking, my center of mass is now forward of my base of support, which means there's a tendency for me to lean forwards and possibly fall. Okay, so things to do with your posture, trying to have good posture where possible, making sure you've got the right walking aid, all these things just on their own will help you maintain your balance. Okay, now in terms of our body processing balance, so very simply we have sort of three elements to it. There's the input, the various senses. Your eyes help with your balance, your inner ear, your feet, the sensation in your feet help with your balance, your joints. Your body's aware of the position of your joints. All this gives input to your brain. Your brain processes this, and then it gives an output to tell you to correct that balance, okay? And that's where the muscles come in. So the stronger your muscles, the better your ability to respond to being out of balance, okay? It's important to understand that when we walk, walking is actually a wonderful, complex process of controlled falls. So when you take a step, you go off balance, you're falling, you correct your balance, okay? So it's really important for all those elements to be working properly. If there's an issue with one of those elements, like if you've got joint pain that stops your joint moving properly, if you've got muscle weakness that stops your muscles responding, you may detect that you're out of balance, but your muscles can't respond to correct that balance, and then you may end up having a fall, okay? So a fall is described, as you'd expect, it's an unexpected event when a person falls. to the ground from any level. So it can be falls from due to stairs or furniture, with or without loss of consciousness. So fall is basically when we drop without wanting to, when we move downwards without wanting to. Okay. And an interesting statistic is around 1 in 3 people over the age of 65 will have at least one fall a year. Okay, and these are all the things that relate to or can feed into having a fall, and some of those we can actually help with. So we have things like medical conditions, balance, which we're going to talk about, or we've spoken about a little bit. Environment as well is a key one that we can, it's an easy win. So often we're looking for easy wins, things that people, we look at, they're using the right walking aid, we look at the kind of shoes you're wearing, we look at your environment, so like if you've got carpets that you might trip over, if you've got steps that are difficult. So sometimes people have falls that are avoidable because the environment or the footwear wasn't correct, okay? So for one, I'll say now, we tell everyone, don't wear flip-flops. Okay, don't wear flip-flops, because when you wear flip-flops, your feet have to stop the flip-flops from falling off. Yeah? Your feet are there to balance. Your feet can't do both. So your feet are either trying to stop your slippers or flip-flops falling off, or they're trying to balance. And sometimes we get so concerned, and I've worked with people who've had a fall because they've had flip-flops, and instead of their foot balancing, it was too busy trying to stop the flip-flops falling off, and they fell and fractured something. Okay, now fragility fractures. So I talked about, so fragility is basically a fracture due to osteoporosis and associated risk factors. So this is when the bones are thinner. So sometimes with age you can get thinning bones that then become vulnerable to having to fracturing when you have a fall, like a low impact fall. Okay, so not, somebody runs into you, a high level or accident or anything, but just a low impact fall. So fall from a chair. It's not that high. When you were younger, if you fell off a chair, it wouldn't have been a big deal. However, as we age, falling off a fairly standard chair can result in fracturing a hip. Okay, so these are sort of fragility fractures. In the UK, there's over 70,000 fragility fractures every year, and as I've said before, falls and associated fractures are often preventable. So I was talking about things like your balance, your footwear, your environment. So there are things we can do to prevent these falls and the fractures, which is why it's so important to maintain health and well-being and independence. Now this chart is a little scary, but this chart basically explains the impact of a hip fracture. So sadly, for 20% of people, within a year after a hip fracture, so often they've had other medical conditions, and a hip fracture basically means they struggle to get back to their previous level of health, and their health sort of spirals down. So sadly, for about a fifth of people, the hip fracture within a year can end up leading to fatality. Luckily, for 30% of people, they can make a full recovery, go back to the same level of function, the same level of ability as before. But for about half of people, if they've had a hip fracture, they do recover, but they never get back to the same level. So it may be they were walking outside independently and now they need a stick. Or it may be they were going on buses before and now they don't, or they were going outside and now they don't. So for about half of people who have a hip fracture when they're older, the result of it is that it limits them from doing all the things they used to do before. So this is the importance of trying to avoid falls and fractures, because it can have a big effect on those who are standing up. So prevention is better than cure, okay? Having a regular medical review is really important to make sure your medications are still needed and appropriate dosage for you as you change. As Paul said, our medications stay the same, but we change, our needs change. So it's really important to have your medications reviewed regularly, and then have a lifestyle that helps your bones. So things like healthy diets, calcium, vitamin D, keep up with regular exercises. Community classes, falls prevention classes. There's also a leaflet for Age UK for things that happen in Islington. And also report to your GP any significant changes in your health. That is so important. A lot of times there is a change in people's health and they just kind of, I'll manage, I'll carry on. Now that change, for instance, your vision. If your eyesight isn't what it used to be and you need to change your glasses or you need to start wearing glasses, putting that off could lead to you not seeing something on the floor and falling over it and having a fall, a fracture, a hip fracture, and then you saw the last slide about some of the implications of having hip fractures. So something that seems really silly, it's important. Or pain. You know, if you're having a new pain in your hip, your knee, your ankle, see your GP, find out, because again, all these things in your body will affect the way your body can function, will affect the way your body can balance. So that little thing may be the difference between you ending up in hospital with a hip fracture and just actually realizing, oh, I just needed to have my glasses changed. Okay, so it may be a little thing, but sadly the consequences can be quite serious. So any changes, do let your GP know. And it also means for us, if you get referred to a therapist, obviously earlier intervention is better. So there's times that people just have a little bit of problem with their balance. We can give them exercises, they can practice things, and their balance will improve, or their muscles are a little bit weak because they're not as active. They can go to classes, we can give them exercises, they can strengthen those muscles, and they can go back to having the same level of ability. So it's really important to let healthcare professionals know if there's any changes so that we know we can help you, we know how to help you.